If you have ever walked into a room and forgotten why you went there, that moment alone does not mean you have dementia or a progressive memory disorder. Perhaps you have misplaced your glasses again, struggled briefly to recall a familiar name, or lost your train of thought after being interrupted. Many adults over 60 notice moments like these and quietly wonder whether they are seeing normal aging or the beginning of something more serious. The answer does not come from one forgotten name or one misplaced object. It comes from the pattern around it. This video is not a memory test. There will be no word list, score, or pass or fail exercise. Instead, we are going to focus on 3 questions clinicians consider over time. Whether there has been a change from your previous ability, whether that change is becoming more frequent or noticeable, and whether it is beginning to interfere with familiar parts of daily life. No result from a few minutes on camera can replace that broader picture. By the end, you should understand what is usually reassuring, what deserves a clinical review, and what kind of sudden change should never be ignored. Here's the question that actually matters, and it is not simply, did you forget something? Everyone forgets things from time to time. One isolated lapse tells a clinician very little. Instead, clinicians look at 3 broader questions. Is this a change from your previous ability? Is it becoming more frequent or noticeable over time? And is it beginning to affect familiar parts of daily life? Change means comparing you with yourself, not with someone else your age. Some people have always needed extra time to remember names. A long-standing tendency like that is usually less concerning than a new change, especially when it has not become more frequent or begun affecting everyday responsibilities. The second question is about the pattern over time. Is the difficulty occasional and fairly stable? Is it appearing more often? Or does it fluctuate depending on sleep, stress, medication changes, or other circumstances? A single difficult week may not establish a gradual decline, but a clear new pattern should not be dismissed simply because daily independence is still intact. The third question is function. Are bills still being paid correctly? Are medications being taken safely? Can you still follow conversations, manage appointments, and complete familiar tasks in the way you normally would? Difficulty with everyday tasks is more concerning than an occasional forgotten name. You do not need all 3 features before raising a concern with a clinician. A meaningful change from your usual ability may deserve attention even before it begins interfering with independence. An isolated lapse is one moment. A clinically useful pattern includes its frequency, its context, whether it represents a change, and what effect it is having on daily life. Keep those distinctions in mind, because they will guide everything that follows. Let's begin with lapses that can occur as part of ordinary aging, because an occasional moment of forgetfulness is not the same as a progressive memory disorder. You may briefly forget a familiar name and have it returned to you later. You may walk into a room and need a moment to remember why you went there. You may lose your train of thought after being interrupted, then recover it once your attention returns. You may occasionally misplace your keys or glasses, but still be able to retrace your steps and find them. Or you may need a little longer than you once did to find the word you want, even though you still understand the word and recognize it when it comes to you. These experiences can happen at any age, but some become more noticeable as people get older. Healthy aging may involve slower processing and slower retrieval, the ability to bring stored information to mind quickly. Divided attention matters too. When you are tired, distracted, hurried, or trying to manage several things at once, information may not be registered as clearly in the first place. That distinction is useful, but it should not be turned into a home diagnostic rule. Sometimes the information is available and simply takes longer to reach. At other times, the lapse occurred because your attention was elsewhere when the information was first presented. Remembering something later can be reassuring, but it does not settle the question by itself. A person with an underlying cognitive change may also remember something later, particularly in the early stages. In the same way, failing to recall one detail on one occasion does not prove that a disorder is present. The broader pattern still matters more. Is the lapse occasional and similar to what you have experienced for years? Can you usually retrace your steps or recover the thought? Or is it becoming more frequent, appearing in unfamiliar ways, or beginning to affect tasks that previously felt automatic? When these moments are occasional, remain close to your usual pattern and do not interfere with everyday responsibilities. They are generally less concerning. But a new or increasing pattern deserves attention, even when each individual lapse seems minor. Context also provides useful clues. A lapse during poor sleep, emotional stress, or heavy distraction may be easier to explain than the same change repeatedly occurring under ordinary circumstances. But a new change during an illness, especially sudden confusion, should not be dismissed as ordinary forgetfulness. Context cannot diagnose the cause, but it gives a clinician important information about when the difficulty occurs and what may be contributing to it. Now let's talk about patterns that deserve a closer look. That does not mean panicking or assuming dementia. It means recognizing when a change is significant enough to discuss with a clinician. One pattern is repetition, asking the same question again shortly after it was answered, not as a single distracted moment, but repeatedly over time. Another is growing difficulty with tasks that used to be familiar. That might include making unusual mistakes while paying bills, losing track of whether medications have already been taken, struggling to follow a familiar recipe, or becoming confused by a routine task that was previously manageable. The third pattern is a noticeable change from the person's own previous ability. The comparison is not with friends, a spouse, or another person of the same age. It is with how that individual normally thought and functioned. Sometimes family members or close friends notice a change that the person has not recognized or has interpreted differently. Their observations do not establish the cause, and they should not be treated as an accusation. But they can provide useful information, especially when they include specific examples and a clear timeline. If someone close to you raises a concern, try not to dismiss it immediately. They may not be correct about what is causing the change, but a recurring observation may still be worth mentioning during a clinical review. So when should you arrange that review? Consider speaking with a clinician when a change is new, keeps recurring, is becoming more noticeable, or begins affecting familiar responsibilities. Do not assume that you must wait until independence has already been lost. A meaningful decline can deserve evaluation even while someone is still managing most parts of daily life. The need becomes more pressing when the change affects safety, such as medication errors, unpaid or repeatedly paid bills, unsafe cooking mistakes, getting lost in familiar places, or concerning problems while driving. Most importantly, a concerning pattern does not automatically mean dementia. It may reflect mild cognitive impairment, medication effects, depression or anxiety, poor sleep, hearing difficulty, or another medical or neurological condition. Mild cognitive impairment is not simply another name for dementia, and not everyone with it progresses to dementia. Some contributing factors may improve when they are identified and treated. Others may require further assessment, monitoring, or support. That is why evaluation matters, not to attach the most frightening label, but to understand what has changed and what can appropriately be done next. Before we continue, which distinction has been most useful so far? Repetition, change from previous ability, or difficulty with familiar daily tasks? Tell me in the comments. It helps me understand which questions deserve a deeper explanation in future videos. This next section is different from the first two, because the response required here is genuinely different. Gradual memory changes that are not accompanied by emergency symptoms can usually be discussed through a planned clinical evaluation. Sudden confusion is different and should not be watched at home to see whether it improves. Call emergency services immediately if someone suddenly becomes confused, has difficulty speaking or understanding speech, develops weakness or numbness in the face, arm, or leg, especially on one side, or suddenly has trouble seeing, walking, balancing, or coordinating their movements. A sudden severe headache with no known cause is another possible stroke warning sign. These symptoms require emergency action even if they improve or disappear after a few minutes. A useful way to remember several of these signs is BEFAST. Balance. A sudden loss of balance or coordination. Eyes. A sudden change in vision. Face. One side drooping when the person smiles. Arms. One arm becoming weak or drifting downward. Speech. Speech that is slurred, unusual, or difficult to understand. Time. Call emergency services immediately. Note when the symptoms first appeared, or, if that is unclear, the last time the person was known to be well. Timing matters because some stroke treatments must be given within a limited period. Call emergency services rather than driving the person yourself when emergency transport is available. A head injury also changes the level of concern. New or increasing confusion after a fall or blow to the head is itself an emergency warning sign. The concern is even greater when it is accompanied by a worsening headache, repeated vomiting, unusual behavior, weakness, a seizure, increasing drowsiness, or difficulty waking the person. Sudden confusion without obvious facial drooping or arm weakness still needs immediate medical help. One possible explanation is delirium, a rapid change in attention, awareness, and thinking that develops over hours or days. Possible causes include infection, low blood sugar, medication effects, dehydration, head injury, seizures, and heart or lung problems. But sudden confusion can also occur with stroke and other emergencies. Some causes can be treated effectively, while others may be life-threatening, and the cause cannot be safely determined at home. The safest distinction is simple. Gradual memory changes deserve a careful evaluation. Sudden confusion requires medical attention immediately. Once an emergency has been ruled out, the next question is not simply whether memory has changed. It is what might be contributing to that change, and several possibilities may be addressable. Certain medicines can affect alertness, attention, and memory, particularly in older adults. These include medicines with sedating effects and some with anticholinergic effects, meaning they block some of the actions of acetylcholine, a chemical messenger involved in attention and memory. The effects may become more noticeable when several prescription or over-the-counter medicines are taken together. Do not stop or change a medicine yourself. Instead, bring a complete medication and supplement list to the clinician reviewing the change. Depression and anxiety can also contribute to problems with concentration, motivation, attention, and recall. That does not mean every memory complaint is caused by mood, or that cognitive concerns should be dismissed as emotional. It means mood is one important part of a complete evaluation. Sleep matters as well. Sleep supports learning and the formation of long-term memories. When sleep is repeatedly interrupted, too short or poor in quality, people may have more difficulty concentrating, thinking clearly, and recalling information the following day. Hearing loss is another contributor that can easily be overlooked. If part of a conversation was not heard clearly, that information may never have been fully registered. Later, the person may appear to have forgotten something they did not clearly hear in the first place. Hearing loss is also associated with cognitive decline, although that association does not prove that hearing loss is responsible for every cognitive change. Other possible contributors include thyroid, kidney or liver problems, vitamin B12 deficiency, heavy or problematic alcohol use, and poorly controlled diabetes. High blood pressure also matters because it can affect vascular and brain health over time. These are not the only possibilities, and this list cannot identify the cause in any individual viewer. The important point is that a memory change and dementia are not automatically the same thing. A proper evaluation can help narrow down whether the difficulty relates to medication, mood, sleep, hearing, another medical condition, or a neurological disorder. When a contributing factor is identified and treated, thinking or daily function may improve. In other cases, treatment may help prevent further harm, manage symptoms, or support safer planning. Either way, identifying the likely cause is more useful than assuming every change is simply aging or assuming it must be dementia. So what actually happens during an evaluation? It is not simply a conversation about whether you occasionally forget things. The goal is to understand whether there has been a meaningful change, how that change affects daily life, and what might be contributing to it. A clinician will usually begin with the history. They may ask what has changed, when it began, how often it happens, whether it is getting worse, and whether it has affected familiar responsibilities or safety. They will also compare your current abilities with how you previously functioned, because your own baseline matters more than comparison with someone else your age. The evaluation commonly includes a review of prescription medicines, over-the-counter products, and supplements. The clinician may also ask about sleep, mood, alcohol use, and existing medical conditions. Hearing and vision may be discussed or assessed because difficulty receiving information clearly can affect both everyday function and cognitive testing. Input from a family member or another person who knows you well can also be useful. Their observations do not replace your own account, but they may add examples or a timeline that is difficult for one person to reconstruct alone. A physical and neurological examination may look at strength, coordination, reflexes, sensation, speech, and eye movements. A brief, structured cognitive assessment may examine several abilities, including memory, attention, language, orientation, and problem solving. No single brief assessment establishes a diagnosis on its own. Blood tests may be used to look for contributing conditions such as thyroid dysfunction, vitamin deficiencies, or other medical problems. Depending on the history and examination, structural brain imaging, usually an MRI or sometimes a CT scan, may also be used to look for strokes, tumors, fluid buildup, or other structural causes and patterns of brain change. When Alzheimer's disease is specifically suspected, some people may also be offered specialized biomarker testing. These tests look for biological signs associated with Alzheimer's disease, including certain proteins measured in blood or spinal fluid, or findings from specialized PET brain scans. They are interpreted alongside the person's history, examination, cognitive assessment, and other results, not on their own. This brings us back to the same principle from the chair stand video. A home observation can provide a useful clue. What it cannot do by itself is identify the cause or provide a diagnosis. The process may begin with a conversation, several brief tasks, an examination, and blood work. It may also continue across more than one appointment, especially if imaging, specialist assessment, or further testing is needed. The exact pathway depends on the person's symptoms and circumstances. If this kind of careful, no panic explanation is useful to you, subscribing is the best way to see the next one. If you are leaving this video wondering what to do next, begin with specific observations rather than a general feeling that your memory is not what it used to be. Write down what happened, approximately when it happened, what was going on at the time, and whether it affected a familiar responsibility or someone's safety. Note whether anyone else witnessed it and whether similar events have occurred before. Keeping a record cannot determine the cause, but it can help you and your clinician see the frequency, context, and timeline more clearly. When you speak with a clinician, bring those examples with you. Saying, "I have been forgetting things," is a reasonable way to begin, but specific examples provide more information. You might explain that you paid the same bill twice, missed several familiar appointments, repeatedly asked the same question, or became confused while completing a task you had managed easily before. Try not to diagnose yourself in either direction while you wait. Do not dismiss a recurring or worsening change simply because the possible explanation feels frightening. But do not assume that one misplaced object or one forgotten name proves that a progressive disorder is present. The pattern, the timeline, and the effect on daily function still matter more than a single incident. There are also broader measures that support both cognitive and overall health. These include regular physical activity suited to your abilities, consistent and sufficient sleep, addressing persistent sleep problems, and keeping conditions such as high blood pressure and diabetes appropriately managed with your healthcare team. Physical inactivity, diabetes, and high blood pressure are among the potentially modifiable factors associated with a higher risk of dementia. That does not mean managing one factor guarantees prevention, but addressing them remains worthwhile for brain, heart, and overall health. Maintaining meaningful contact with family, friends, or community can also support well-being. Social isolation and loneliness have been associated with cognitive decline, although that association cannot tell us what caused an individual person's symptoms. None of these steps replaces an evaluation when a meaningful change is present. Exercise, supplements, and lifestyle habits should not be treated as a cure for an unexplained cognitive problem. Their role is to support overall health while the actual cause is investigated and appropriately managed. Occasional lapses can occur with normal aging. They may involve slower retrieval, divided attention, temporarily losing a word, or misplacing something from time to time. They are generally less concerning when they remain close to your usual pattern and do not progressively interfere with familiar parts of daily life. Patterns that deserve a clinical review include repeated questions, increasing difficulty with familiar tasks, and a noticeable change from your own previous ability. The comparison is not with someone else your age. It is with how you normally think and function. Sudden confusion belongs in a different category. It can be a stroke warning sign or indicate another medical emergency, and it requires immediate medical help. Call emergency services immediately, especially if the confusion appears with weakness, facial drooping, speech difficulty, vision changes, loss of balance, or a sudden severe headache. Waiting to see whether the symptoms improve is not safe. Between ordinary lapses and sudden emergencies are many possible contributors to gradual memory change. These may include medication effects, depression or anxiety, poor sleep, hearing difficulty, thyroid problems, vitamin B12 deficiency, and other medical or neurological conditions. Some may be treatable or manageable. Others may require monitoring, support, or more specialized evaluation. An isolated lapse is one moment. What deserves closer attention is a meaningful pattern, a change from your previous ability, a change that keeps recurring or progressing, or one that begins affecting daily life. That pattern cannot tell you the cause by itself, but it can help you recognize when a lapse is generally less concerning, when to arrange a proper evaluation, and when medical help should not be delayed. I'll see you in the next one.